Hi everyone, welcome to week 6 of our virtual series. Today we have Amy presenting for us on the importance of posture and diaphragmatic breathing and how it works into our wellness and our overall performance. Amy, I'm going to turn it over to you.
Thank you. Hello everyone. My intention here today is just to give you a brief overview of posture and diaphragmatic breathing with a PowerPoint, and then we're going to go right into a demonstration and little exercise into how to put these techniques into practice. They're pretty powerful and pretty important to just being well as being a good athlete. So we'll go right through these because I know we don't have a whole lot of time. So posture is just how you hold yourself up against gravity, particularly your head, because that's where the brain is and the eyes are, and that tells us what's going on for the most part. It's affected by contractions of bones and joints, and so that's how we change it. And good posture can be limited by tightness of muscles, weakness, instability, pain. So those are all things that you need to take into account. Types of posture, you've got dynamic, like our baseball pitcher. And in athletics and sports, there's all kinds of dynamic postures that we need to be considering. Another type of posture is static posture, which there aren't many of those in athletics, but we do them a lot as professionals, sitting, standing. It's an important part of life to be able to hold a static posture. Basics of posture. Your ear needs to be over your shoulder, over your hip, over your knee, and that's how you're lined up. And ways to check that is by standing in a doorway. And I'm going to go through that as our postural exercise. So we'll come right back to that. And these are just a list of how you can correct your posture, which is important. And again, we'll do that in the exercise that I show you in a minute. I wanted to point out to you good sitting posture, which I'm not sure that this is a picture of a guy at a computer, and I'm thinking of my children who are 19 and 21, and I don't think they ever sit at a desk with a computer, but it's something that I wanted to point out that if you're going to spend long times at a computer, your elbows, hips, knees should be at 90-degree angles with each other, and your feet and back should be well supported. I know we use a lot of cell phones and iPads and digital devices, and most of the time we're not even sitting in a chair when we use them at home and as students. So something to think about is if you're going to spend a long time doing a term paper, or do we even do term papers anymore, you want to think about getting in a good position, because it's important for maintaining good muscle balance and length rather than lying in your bed or on your side working on your laptop. It might pay off to find a place where you could get a workstation that looks like this. Some other things I wanted to quickly mention is that a good posture typically starts with the spine or the core. You have 3 curves, actually 4 curves. You have a sacral kyphosis, a lumbar lordosis, and a thoracic kyphosis and a cervical lordosis. So that looks like, I don't know if I can I can get my spine in here. So you can see kyphosis goes this way, lordosis scoops that way, kyphosis goes this way, cervical lordosis goes that way. So your spine just kind of scoops back and forth, and that's natural. I wanted to mention scoliosis. A lot of times we screen for them in school, and it freaks people out, and it really doesn't need to. If it's a severe scoliosis, you might need treatment, but typically we talk about scoliosis, we identify scoliosis. Half of us have a mild form of scoliosis. but they don't even need to be treated. Only about 3% of people have a significant problem that needs to be treated. So I wanted to mention that because it seems scary, but it's kind of normal. Postures in athletes. So you can see this woman, that's a posture that she does a lot, often, frequently, and that can be a problem. Exposure to repetitive and asymmetrical postures can eventually lead to changes even in your bones. If you do it frequently enough, your bones will change position as well as potentially shape. So just something to think about. If you do a lot of that posture, like our gymnast here, you might want to go in the other direction when you're not doing that move. Poor posture can lead to inefficiency. So if you're not lined up well when you do an activity, it can affect your performance. And poor core and postural stability can make it difficult to perform at all. Benefits of improving your posture can be physical, mental balance. Your whole body is affected by good posture, so you want to stand up tall. Psychologically, there's been a lot of research on how this is the power pose. Wonder Woman is the classic power poser. And there's been studies that say that by improving your posture, you can improve your psychological outlook and even feel more powerful. Certainly as an athlete, if you stand up tall when you're walking onto the court or whatever, it gives you a psychological advantage against your opponent. So when we're going to go over these exercises, some things to remember is posture is something that needs to be practiced. You need to do repetitions. And hopefully I'm creating awareness to you today that it will make it so that you can practice these when you're walking down the hall at school, when you're walking up the stairs in your house, getting in and out of the car. Everything you do has a posture. So being mindful of that posture will help you improve it. So another little idea is as you practice, and I'll talk about this again as we go into the drill, but if you feel something that's tight, give it some attention. Self-massage is a great way to do that. If you're tight, stretching is a great way to do that. If you feel like you're just not able to hold a posture when you're lifting or performing your sport, think about working those muscles a little harder. Talk to your coach and get some ideas for strengthening. Athletic trainers can help you with that, physical therapists. Remember, an ounce of prevention is worth a pound of cure. I love that expression because doing a little bit now could keep you out of physical therapy in the athletic training room, and do it throughout the day. Poor posture in your daily life has an outcome on the field. On to diaphragmatic breathing. It's the concept of breathing with the muscle called your diaphragm, which helps to create negative pressure as it expands and causes the lungs to expand. We were all born breathing as diaphragmatic breathers. It's the way human beings are programmed to breathe. But somehow as we grow up in childhood, we forget how to do that. And there's some research on that says that it's because we're all taught to suck in our stomach. As I'm teaching you posture, stand up tall, that part of good posture is engaging your core, and that maybe socialization teaches us to get out of diaphragmatic breathing. Tension, anxiety, that might also lead to that as well. The physiology of it is that to diaphragmatic breathe, if you're not naturally a diaphragmatic breather, you have to learn how to engage your core, and it takes some mental focus. We're going to talk about that. That's part of our exercise session. Here's just a little picture of the diaphragm. As you breathe in, it sucks down and it allows your lungs to expand. The ribs do elevate, but we want to emphasize the belly expanding, the stomach relaxing and going out. Expiration is a passive relaxation of the diaphragm, which allows the air to go back out of the lungs and ribs as they contract and shrink down. We're going to go through this drill. We're just going to put one hand on our chest, one hand on our belly, and we'll work on breathing. But we're going to do that in a minute, so I'm going to skip over that. There are lots of different ways to practice diaphragmatic breathing, and I'm going to take you through a few today quickly. The best way to get good at it and to really learn how to do diaphragmatic breathing is to set a timer, put one hand on your chest, one hand on your belly, and learn how to really expand your diaphragm. As you contract, it will make your belly your stomach come out a little bit. You'll feel that expand under your hand. As you breathe out, you'll feel your diaphragm relax and your belly will sink back down toward the bed if you're lying down. And it's a good way to practice it lying down, because if your abdominal muscles are tight, then you're actually working, you have gravity eliminated, so you can do it that way. Or lying on your side, your gravity eliminated as well. But that eliminates posture and other complications that you need to think about when you lie down. So as you get good at that, just practicing breathing for 5 minutes, breathing in, breathing out at your own pace, just paying attention to your diaphragm moving. Then you can move on to sitting, standing, walking. Hopefully eventually running. If you're a distance runner, it's hugely beneficial to diaphragmatic breathe as you run. And that would be a good habit to get into. But it takes practice if you're not naturally a diaphragmatic breather. Typically the inspiration to expiration, that's what I to E rate is 1 to 2, because the expiration is passive. It takes longer to occur. You can also change the pattern, the inhalation, exhalation. You can hold your breath in between the inhalation and exhalation, which just creates more mindfulness of the breathing. And then Tai Chi, we'll do a little Tai Chi move, hopefully, if I can get my computer to allow me to demonstrate that. Tai Chi is just a form of diaphragmatic breathing, or not just, but part of that is diaphragmatic breathing. The benefits of diaphragmatic breathing, this is just a quick slide to say that diaphragmatic breathing stimulates the vagus nerve, which is the superhighway of the nervous system, and it creates a parasympathetic response, which is a relaxation response. So if you're in a mode of relaxation where we should all be functioning day-to-day wellness, versus parasympathetic, which is fight or flight, you're running from a tiger. And a lot of us are in that mode a lot when we shouldn't be in that fight or flight. Diaphragmatic breathing gets you back to parasympathetics, relaxation, digestion, proper hormone release, lowering blood pressure. It mechanically helps to stimulate the lymphatic system, but also parasympathetics helps to strengthen your immune system. These are just more, it's helpful in managing blood sugar. So these two slides just tell you that diaphragmatic breathing is good. It helps you to be well, helps you to be a good, strong athlete as well. So I'm going to go into a little demonstration. I'm going to turn my computer here, and I'm just going to show you on myself. And hopefully you're all in a place where you can jump up and try this with me. I'm going to stand in a door jamb, because that's where I like to do this best. But if you don't have access to a door jamb, just stand up nice and tall. What the door jamb does for you is aligns your spine up on a straight edge. It's like a plumb line, so you know that everything is symmetrical, everything is straight from front to back and from side to side. So what you should feel as you either stand up tall or lean into the door jamb a little bit is you should feel the back of your head touching the door. You should feel your spine between your shoulder blades and your tailbone touching the doorway. Or you should, if you don't have a door jamb available, you should should just feel that your ear is over your shoulder is over your hip is over your knee, which is centered over the middle of your foot. So, and you should feel fairly well balanced. And then you should start to think about coming up tall, like someone's pulling you up with a string, like a puppet. So you're elongating your whole spine and your body. You're tucking your chin slightly. So you don't want your nose to come up, and I can turn sideways to show you this. So you don't want to elevate your chin. You don't want to extend your spine this way, but you want to tuck your chin, and that's called axial extension. My ear should be over my shoulder, and I'm going to just slightly pull my shoulder blades together so my shoulders come back a little bit more over my hips. I'm going to engage my core just by sucking in my abdominal muscles, and that helps to support my whole posture from my core up. My hips, my glutes are engaged a little bit, but generally my hips, my knees, my feet are pretty soft. So, or soft, relaxed, but engaged. So I'm not pushing them back. I'm not tightening them too much. So that's how you practice good posture. Once you get good at it on the door, then you should be able to walk away from the door and know and feel that you're up tall. A mirror is a really good place to, in front of a mirror is a good place to practice this. If you have a full length mirror, then you can see what your hips, knees, and ankles are doing. But hopefully you can feel what your the rest of your body's doing. Get somebody to give you feedback too. Your mom's probably a good one to do that, because they're always telling you to stand up straight, or that's what my kids tell me. Practicing that posture, that's just a basic postural exercise. You can, once you get good at that, you can practice shifting onto one foot and maintaining that posture. It's very important when you do single leg postural exercises that you don't allow your hip to drop down. So yeah, I'm not going to be able to show you that, but if you're standing on one leg, you don't want your hips and shoulders to drop down on the other side. The strength comes from when I'm standing on the left hip, I want the right hip to stay up. Okay? Move this. Hopefully my computer doesn't crash. Maybe I will plug it in. That wouldn't be bad. Okay, so diaphragmatic breathing. We're going to do this standing up because hopefully all of you, oh no. There we go. I think I'm back. We're going to do this standing up because we probably don't have a good place to lie down. But if you're in a good place, you want to lie down, it would be easier to learn this lying down. So you're going to put your right hand on your chest and your left hand on your belly, on your stomach, and you're just going to breathe in, and as you breathe in, your left hand is going to rise up or move away from your spine, and then you're going to breathe out. So let's just practice that for a little bit. And I recommend when you do this, just it takes some relaxation when you're trying to do a breathing exercise. You kind of have to be still. So we're breathing in and then breathing out. As you breathe out, you should feel your left hand sink back toward your spine. And again, it should be about 1 in for every 2 out. When you're starting to learn diaphragmatic breathing, I would just pay attention to what is comfortable for you and don't try to change that. What you're trying to change is that your right hand on your chest is moving minimally, and the left hand on your stomach is expanding and then relaxing. So we'll work on that just a little bit. So you're just feeling your right hand is still and your left hand is moving, the hand that's on your stomach. You'll feel a little bit of movement in your chest, but it should be a lot less than in your belly. So, good. So then once you get good at that, and you can try it in different positions. If you can do it in standing, that's probably pretty good. A lot of my patients, I have to have them lie down to even start to work on it. But once you get good at that, you can really work on deepening your breathing. So you're breathing in and really expanding your belly, trying to hold it out longer. So maybe counting to 4 as you're breathing in, and then count to 8 as you breathe out. So let's just do a couple breaths like that. Let's breathe in. 1, 2, 3, 4. And breathe out. 3, 4, 5, 6, 7, 8. Breathe in. 1, 2, 3, 4. Breathe out. 2, 3, 4, 5, 6, 7, 8. Which that might be a little bit long if you're just learning how to breathe. It might feel forced, and that's why it's a good thing to practice on your own when you can make up what's comfortable for you and get good at it. Another drill that's helpful sometimes is if you breathe in, you hold your breath, and then you breathe out. So let's do that. Let's breathe in for 2. 1, 2. We're going to hold our breath for 2. 1, 2. And breathe out for 4. 2, 3, 4, 5. All right. So let's try that again. I got distracted on my counting. So let's breathe in for 2. 1, 2. Let's hold it for 2, 2. And let's breathe out. 1, 2, 3, 4. So let's breathe in. 2, 3, 4. Yeah. I got distracted on my counting again. Let's do that again. Let's breathe in for so now that everybody's hyperventilating, we got the idea. We're going to breathe in for 2. 1, 2. We're going to hold it for 2, 2. And we're going to breathe out for 4. 1, 2, 3, 4. Good. So that just gives you an idea. And there's all kinds of ways you can breathe really quickly. You can breathe in through your belly and then expand your chest and then breathe out. But the basic breathing in through your belly without moving your chest and breathing out is a super important skill to learn. And the last thing I wanted to mention is Tai Chi, and I'm going to try to back up so that you can see this. And Tai Chi is just breathing with movement. So I'm going to breathe in as I move my arms up, and I'm going to breathe out as I move my arms back down. And I'm also, you can't see my feet, but as I breathe in, I'm going to come up onto my toes. So I'm going to breathe in, come up onto my toes, and breathe out, coming back onto my heels. And I'm going to breathe in, coming up onto my toes. This is a Tai Chi move called flowing motion. Back onto my heels. But you can see how that works. Your breathing, your balance, your coordination, lots of good things going on there for you. So that's why Tai Chi is so effective. Okay, I guess I asked for questions at this point. I asked Jessica, help.
Hi, Amy. Thanks for the presentation. Just a few quick questions before we send it over to Zach for our workout for today. Do you have any opinions on postural shirts, straps, or even like the wearable devices like Lyft that connect to your phone and provide feedback throughout the day?
I've tried some of them with patients. Um, yeah, I don't think there's any research to say that any of them are effective, and I find compliance is really not good. People love to buy these things, including myself, and it's hard to be compliant with them. I think the best way the best thing for your posture is to be mindful of your posture, and just get in the habit of thinking of it, and knowing that it's really important for performance across the board in life and in sports is important. And hopefully that motivates people just to do it. And that's the thing with that. You don't need a device. You don't need a gadget just to stand up tall. And that's the best exercise. Good question.
Sounds good. And then my second question for you is a little bit more related to the breathing aspect. If an athlete is having trouble breathing, or they find themselves like really sucking wind a lot, but they're in shape and there's no asthma on board, who do you recommend them maybe seeking help to?
A pulmonologist.
Okay.
Yeah, I mean, that's a tough question because I mean, there could be a lot going on, and probably, they definitely want to seek a medical opinion.
Okay. I know some of our speech colleagues too also can work on some breathing issues and things related around vocal cord dysfunction that can often be misdiagnosed also.
Right. And just first of all, working on diaphragmatic breathing. I mean, maybe they don't breathe well. That's a great place to start, because most of us don't breathe well, and it's not going to hurt anything. It can only help. So
sounds good.
Yeah. Physical therapists, speech therapists, hopefully athletic trainers, can teach this as well. So
thank you for your time today, Amy.
Well, thank you. Thanks for the opportunity. I appreciate it. And I guess I'll see you tomorrow.
Yep. And now we'll turn it over to Zach to get our workout started.
All right. Thanks.
Thanks, Amy. I think that's certainly that's a good topic there that we need to talk about. And I think a lot of athletes don't realize how much posture and breathing plays a role in athletic performance. So that's certainly a much needed education session there. So we appreciate it.
I hope I didn't take too much of your time. I'm always long-winded.
No, that was perfect. I loved the breathing and posture exercises as well. So no, we appreciate it. That was perfect.
All right. Thanks. Have a good day.
Yep. Thank you. All right, everybody. So we will roll right into the workout. Always focus on that posture the whole time we're doing this workout, nice and controlled. And we have something a little different today. We're doing a negative workout or an eccentric workout, where we're going to really focus on the eccentric or negative portion of the exercise. So I'll kick it over to Laura in the video. She'll explain it a little bit, and we will go from there. 1 second. All right, here we go, right into the workout.
Hi, I'm Riley Zedek. I'm 16 years old. I go to Spring Grove High School and I play volleyball. I had a patellar dislocation and I went to WellSpan for treatment. And Laura is actually my volleyball coach.
Hey everyone, my name is Laura Faree. I am back with week 6 workout. Today we are doing a different style of a workout. We are doing what's called a negatives workout. I have with me Riley, one of my players from our volleyball team. We are going to start with our dynamic warm-up. So we're going to start with those arm circles. So for 30 seconds, we're going to put our arms out. Just circle forward. Do big, alternate big, small. We're going to switch and go backwards at halfway. And switch, go backwards. And get right into jumping jacks. We're going to do 30 seconds of jumping jacks. Good. Again, focus on staying light on those toes. Get the arms up above head. 3, and stop. 1. Good. Your next one we're going to get into is going to be walking inchworm. So you're going to reach down to the ground, walk those hands out into a full plank, walk your feet in, and you're going to go down and back. So walking out. Let's do one more. Good. Turn around and you're going to do the same thing going back. Good. Try to focus on keeping those legs straight the whole time. Nice job, Riley. All right, next one is going to be our heel-toe walk. So let's go. First lap down, we're going to walk on our heels. Keep those toes pointed towards the ceiling. Turn around. Now we're going to walk on our tiptoes. Good. Next one is going to be our hip in and out. So we're going to go down. You're going to rotate your hip out, bring it up, out. Good. Switch on the way back. Now you're going to bring the hips in. You guys should be familiar with this from our FIFA 11 workout last week. Good. Our next one is going to be our figure 4 walk. So you're going to walk. You're going to bring your right leg rested on that left knee, kind of sit down into it. Take a few steps and alternate. Left leg, right knee. Feel a good stretch in the back of the leg, right in kind of into the glute. And do it on the way back. Next one is going to be those Frankenstein walks, which you guys have been doing. You're going to walk, you're going to kick your one leg up, reach with the opposite arm, try to keep the leg straight. Feel a stretch in the hamstring. Going up and back. Good. Last one is going to be our walk with a lunge twist. You're going to lunge down, twist to the opposite leg, back up. Down and back. All right, just kidding guys, we have one more exercise actually. Our last one here is going to be our standing dynamic hamstring stretch. You're going to stand, you're going to reach down to the ground, kind of push your weight back into the heels, come up nice and slow, feel a stretch through your hamstring, and then you're going to reach down, touch the opposite foot, so right hand, left toe, back up, same thing, you're going to do the same thing, left hand, right toe, back up. You're going to do 5 of those total, so 4 more. Down into the center, up, down to the right, or to the left, I'm sorry, down and to the right, back up, and 3 more. Again, making sure you feel a good stretch through the hamstring. Keeping the legs nice and straight. 2 left. Good, last one. Center. Go to the left, to the right, and up. Good job, guys. That was our warm-up. All right, everybody, time for the workout. So today's workout is called a negatives workout. So for every movement, we are gonna go down for 3 and up for 1. We're working the eccentric motion of each exercise. So the first exercise we're going to do is going to be a push-up. I'm gonna show you a full push-up, but then we'll work on modified if you can't do it. So get in the plank position here. Make sure your hands are under your shoulders. You're gonna go down for a count of 3. So you're gonna go 1, 2, 3, up for 1. For every exercise, we are doing 15 reps, and we're gonna do this whole round twice. So in about 5 seconds, we're gonna get started. So get down into a plank push-up here. Good. And again, we're gonna do 15 reps. So we're going down for 3, up for 1. Ready? And go. 2, 3, up. Good. Up. Work on nice and controlled. Work with the range of motion you've got. You do not have to go down the whole way. If this is getting too tough, you can switch and go down to your knees. So from here, you're still gonna go down, 1, 2, 3, up. Down, 1, 2, 3, up. Nice job, Riley. All right, our next exercise here is going to be squats. So feet about shoulder width apart. You're gonna go down for 3, 1, 2, 3, up. Fully extend through the hips. Down, 1, 2, 3, up. 15 of these. Good, 2, 3, down, 1, 2, 3, 4, 5, 6, 7, keep it up, 8, halfway guys, 9, 10, 11, 12, 13, 2 more, you got it. Good. All right, next movement, guys, is going to be straight leg followaways. This is gonna work on your core. What you're gonna do is you're gonna lay on your back. Feet are gonna go up in the air. We're gonna alternate legs. We're gonna start with our left leg here, and you're gonna go down for a count of 3. You're gonna let that leg fall to the side. 1, 2, 3, up for 1. And then we're gonna switch and go to the right leg. So 1, 2, 3, up for 1. And alternating each time. Up, good. Down, 1, 2, 3, up, good. Up, 1, 2, 3, up. That's 2. We got 13 more. Good. 5. Keep that core nice and tight. Keep that back flat against the floor. By tilting your pelvis back into the floor, you're gonna keep that core nice and contracted. Sorry, Riley, I lost count. This is number 8. Good. How you feeling? Good. Sorry. Try to keep the feet up. Good. Awesome. Good. All right, guys. Next one we're gonna get into is called a pike shoulder press. You're kind of gonna get into that downward dog position, keeping the hips up in the air, working our shoulders. We're gonna go down for a count of 3. 1, 2, 3, up for 1. 1, 2, 3, up. Yep. Make sure you're counting down for 3. 1, 2, 3, good. 2, 2, 3, 3, 2, 3, 4. 1, 2, 3, 5. Good. 6. 1, 2, 3, 7. Good job. 8. You got 7 more. 9. You got it. 10. 11. It's all right. Stretch out if you have to. Do like Riley did and rock back onto your heels. Yep. 14. Last one, Riley. 15. Good. All right, everybody, we're gonna get into our next exercise now. It's going to be a split squat. So let's start with our left leg first. You're going to basically be in a lunge position. Again, you're going down for a count of 3. So you're going to go 1, 2, 3, up for 1. We're gonna do 15. 2, 1, 2, 3, 3, 1, 2, 3, 4. Good. 5. Good job. 6. Again, work with the range of motion that you can. If you can't get that back knee to touch the ground, that's okay. 12. 3 more. Good. Now we gotta switch and let's work on our right leg. So right leg in front. Again, going down for a count of 3. And we're gonna do 15 reps. So 1, 2, 3, up. 1, 2, 3, up. That's 2. 3, 4. Good job. 6, 7, 8, 9. If this is too easy, you can get some dumbbells and put dumbbells in your hand. Add a little weight to it. 12. 3 more. 13. Last one. Good. 15. All right. Next one, guys. We're gonna go back to our core workout. We're gonna get down on our back again. This time, both legs are gonna be dropping to the side. So you're gonna put your arms out flat on the ground, both feet straight in the air. Keeping them together, you're gonna go down for a count of 3. So 1, 2, 3, back up to the center, and then alternating sides. Go 1, 2, 3, back up to the center. Up, good. That's 1. You got 14 more. 2. 3. Good. Again, keeping that core nice and tight, keeping that pelvic tilted, back flat against the floor. Good. 8. Halfway, guys. How you feeling, Riley? Ooh, my stomach's making funny noises. Good. 10. You got 5 more, guys. 12. Good. Down, 2, 3. Down, 2, 3. 13. 14. This is your good. Last one. 2, 3. Up. Down, 2, 3. Up. Good. Nice job. All right, Ashley, still standing on your back here. We're gonna do glute bridges. So again, keeping that pelvis tilted. You're going to go up, down, 2, 3. Up, down, 2, 3. Nice and controlled down. Good. 2. 4. 5. 6. Good job. 7. 9. 10. 5 more, guys. You got it. 11. 12. 13. 14. Last one. 15. Good. All right, staying down on the ground, we're gonna do sit-ups. What you're gonna do is you're going to keep your heels on the ground, toes pointed up in the ceiling, towards the ceiling. You're going to come up for 1 and slowly roll that spine down for a count of 3 and back up. 1, 2, 3, up, good. 3, up, 4, 5, slowly down, 6, count 1, 2, 3, 7, 8, 9, 10, keep going, you got it, 11, good, 13, 2 more, 14, last one, 15, nice job. All right, last one in this round, guys, is going to be bent knee calf raises. So what you're gonna do, I'm gonna give Riley here a stick to hold on to just for balance purposes. If you can hold on to a counter, you're going to bend the knees, you're gonna go up for 1, and slowly lower the heels down to the ground for a count of 3. So you're gonna go up 1, down, 2, 3, down. We're doing these together. Yep. So up 1, 1, 2, 3. Good. Keeping the knees bent. This is gonna target your calf muscles a little differently than what you're probably used to. Turn your foot up just a little bit. There you go. Just rolling to the outside of me. Good. And 5 more. 2 more. 14. 15. Good. Nice job, guys. You completed round 1. We're going to take a 1-minute rest, and then we're going to repeat all of that one more time.
Quick 1-minute rest, then we'll jump right back into round 2. Second time through it, it should be much smoother with those movements after having a little round or 1 round to practice them. So second round, focus on the quality of movements a little more, be a little more fast paced. Start back up here in a little over 30 seconds.
Rolling. Okay. All right, everybody, ready for round 2. We're gonna start off with those push-ups again. So get down into a plank position. Riley here has convinced me to do the workout with her for the second round, so we'll see how I do. So again, we're going down for a count of 3. 1, 2, 3, up for 1. That's 1. Down, 2, 3, 2. 2, 3, 3. Down, 2, 3, 4. Down, 2, 3, 5. Down, 2, 3, 6. Down, 2, 3, 7. Down, 2, 3, 8. Down, 2, 3, 9. Down, 2, 3, 10. Down, 2, 3, 11. Down, 2, 3, 12. Down, 2, 3, 13. 2 more. Down, 2, 3, 14. Down, 2, 3, 15. All right, guys. Right back into those squats. Again, you're gonna go slow and controlled. Feet are gonna be shoulder width apart. You're gonna sit back in those heels. You're gonna go down slowly, 2, 3, up for 1, down, 2, 3, 2, down, 2, 3, 3, down, 2, 3, 4, down, 2, 3, 5, down, 2, 3, 6, down, 2, 3, 7, down, 2, 3, 8, down, 2, 3, 9, down, 2, 3, 10, down, 2, 3, 11, down, 2, 3, 12, down, 2, 3, 13, 2 more, down, 2, 3, 14, last one, down, 2, 3, 15. All right, guys, we're gonna get right into the straight leg followaways. Again, you're gonna lay flat on your back. Try not to kick Riley here. Legs straight up in the air. Arms out to the side. One leg is dropping at a time. Let's start with our left leg. We're gonna go down, 1, 2, 3, up. Right leg, down, 2, 3, up. 1, down, 2, 3, up. Down, 2, 3, up. 2, down, 2, 3, up. Down, 2, 3, up. 3, down, 2, 3, up. Down, 2, 3, up. 4, down, 2, 3, up. Down, 2, 3, up. 5. How you doing, Riley?
Good.
Up.
How are you doing?
I'm all right. Down, 2, 3, 6. Down, 2, 3, up. Down, 2, 3, up. 7. Down, 2, 3, up. 8. Down, 2, 3, up. 9. Down, 2, 3, up. Down, 2, 3, up. 10. 5 more. Down, 2, 3, up. Down, 2, 3, up. 11. Down, 2, 3, up. Down, 2, 3, up. 12. Down, 2, 3, up. Down, 2, 3, up. 13. Down, 2, 3, up. Down, 2, 3, 14. Last one. Down, 2, 3, up. Down, 2, 3, 15. All right. Just got me working out here, guys. All right, our next one is going to be a pike shoulder press. Again, you're getting in that downward dog position here, keeping those hips up towards the ceiling, working the shoulders, going down for 3, up for 1, down, 2, 3, up, down, 2, 3, up, down, 2, 3, up, 3, down, 2, 3, up, 4, down, 2, 3, up, 5. Riley here is doing a modification. 6, she's just rocking back and slowly coming out for a count of 3, 2, 3, 8, down, 2, 3, 9, back, down, 2, 3, 10, down, 2, 3, 11. For those of you who can keep doing the pike shoulder presses, 2 more, 2, 3, last one. Good. Alrighty, guys. We're about halfway through this round. We only got about 5 more exercises to go. Next one here is going to be the split squat. So let's start with that left leg again. And what we're gonna do, keep that left leg out. Down for 3. 1, 2, 3. Up. Down, 2, 3. Up. 2. Down, 2, 3. Up. 3. Down, 2, 3. Up. 4. Down, 2, 3. Up. 5. Down, 2, 3. Up. 6. Down, 2, 3. Up. 8. 7. Down, 2, 3. Up. 8. Down, 2, 3. Up. 9. Down, 2, 3. Up. 10. 5 more. 11. Down, 2, 3. 12. Down, 2, 3. 13. Down, 2, 3. 14. Last one on this leg. Down, 2, 3. Up. 15. Switch legs. Right foot's gonna go out in front. Doing all right? Yeah? All right, guys. Right leg forward. Down for a count of 3. 1, 2, 3. Up. 1, 2, 3, up, 2, down, 2, 3, 3, down, 2, 3, 4, down, 2, 3, 5, down, 2, 3, 6, down, 2, 3, 7, down, 2, 3, 8, down, 2, 3, 9, down, 2, 3, 10, down, 2, 3, 11. We got 4 more, guys. Down, 2, 3, 12, down, 2, 3, 13, down, 2, 3, 14, down, 2, 3, 15. All right, guys, we got 4 more. Next is gonna be those windshield wipers. So down on our back again. This time, both feet are staying together. Again, tilt that pelvis back into the ground, keeping your back nice and flat into the floor. Feet together, going down to the left, and then back to the center, down to the right, and that's 1. Arms out to the side, and go. Down, 2, 3, up. Down, 2, 3, up. 1. Down, 2, 3, up. Down, 2, 3, up. 2. Down, 2, 3, up. Down, 2, 3, up. 3. Down, 2, 3, up. Down, 2, 3, up. 4. Down, 2, 3, up. Down, 2, 3, up. 5. Gotta keep going, right? Coach is tapping out on this one. Good. 6. Up. Down, 2, 3, up. 7. Down, 2, 3, up. Good. 2, 3, up. 8. Halfway. Again, if you can't go down the whole way, just modify it, just go to where you can. Just nice and controlled for that count of 3. Good. And back up for 1. 2 more. Good job. Good job, Riley. And stop. Good. All right, guys, still staying on the ground here. We're gonna do those glute bridges. Again, I want you to focus on squeezing your glutes together, lifting those hips up. You're going to go up for 1 and down for 3. So ready, Riley? Yep. And go. Up, down, 2, 3, up, down, 2, 3, 2, up, down, 2, 3, 3, down, 2, 3, 4, down, 2, 3, 5, down, 2, 3, 6, down, 2, 3, 7, down, 2, 3, 8, good, down, 2, 3, 9, down, 2, 3, 10, down, 2, 3, 11, down, 2, 3, 12, down, 2, 3, 13, down, 2, 3, 14, last one, down, 2, 3, 15. All right, guys, next one, gonna be those sit-ups. We got 2 more exercises before we get to our cool down. Again, starting flat on the ground. Put your heels on the ground, toes pointed up. You're gonna come up fast, up for a count of 1, down for a count of 3. So we're gonna come up, down, 2, 3, up, down, 2, 3, 2, up, down, 2, 3, 3, down, 2, 3, up, 4, down, 2, 3, up, 5, down, 2, 3, up, 6, down, 2, 3, 7, down, 2, 3, up, 8, down, 2, 3, up, 9, down, 2, 3, up, 10, down, 2, 3, up, 11, down, 2, 3, up, 12, down, 2, 3, up, 13, down, 2, 3, up, 14, last one, down, 2, 3, up, 15. Nice job, guys. We got 1 more. We got those bent knee calf raises.
Do you want this?
You can have it. Again, if you need to for balance, you can hold it to a countertop, a chair, back of a sofa. You're gonna do those calf raises. Knees are gonna be bent slightly. You're gonna go up for 1. Nice and controlled, down for 3. Good, 1, down, 2, 3, 2. Down, 2, 3, 3. Down, 2, 3, 4. Down, 2, 3, 5. Down, 2, 3, 6. Down, 2, 3, 7. Down, 2, 3, 8. Down, 2, 3, 9. Down, 2, 3, 10. 5 more. Down, 2, 3, 11. Down, 2, 3, 12. Down, 2, 3, 13. Down, 2, 3, 14. Last one, 2, 3, 15. All right, guys, you have completed our negative workout for the day. I hope you enjoyed it. We're gonna take a quick 30-second break and get right into our cool down. All right, guys, we're gonna get right into that cool down that we've been doing for the past couple of weeks. So we're gonna start with that downward dog into the prone press up and child's pose. We're gonna start with 3 of those. Into a downward dog position here. Press the weight through the heels, feel a stretch in the back of the calves, through the hamstrings. Down into prone press up, fully extend those arms. Press those hips down into the floor, and then rock back onto your heels for child's pose. Good. Back up into the downward dog position. Down into prone press up. Feel the stretch, rock back on the heels. 1 more. Down into prone press up. Back onto the heels. Good. All right, from here, let's bring our left leg forward for that pigeon pose. Extend that right leg back. If you feel a stretch here with your arms extended, that's fine. If you don't feel much of anything, come down onto your forearms. We're just gonna hold it here for a little bit. You should feel a stretch coming right through the glutes of your left leg. Good, let's switch. Let's bring our right foot forward here. Bring that foot kind of right into the armpit of your left arm. Fully extend that left leg back. Down onto your forearms for a good stretch. If this is too much, you can have your arms fully extended. Take some deep breaths. Good. From here, let's get into that kneeling position. Let's keep our right knee on the ground. Let's bring our left foot up. Arms above head. Reach up toward the ceiling. Bend over to the left. Bend over the leg. Again, you should feel a little bit in that right hip flexor. If you don't, lean slightly forward. Good, let's switch. Right foot forward, arms up above head, reaching up towards the ceiling, bending over to the right. Lean slightly forward so you can feel that stretch through the left hip flexor here. Good. Back down onto the ground for that favorite pretzel stretch we have. Laying flat on your back. Let's start by bringing your right leg into your left shoulder, crossing it over. Keeping those shoulders flat on the ground. Try to pull that left foot into your buttock. Again, you want to focus on keeping your shoulders flat. If you can't bring your left foot in the whole way, that's all right. Just do what you can until you feel a stretch. Take a few deep breaths, relax. All right, let's switch legs here. Again, bring that left leg into the right shoulder. Pull it across the body. Bring that right foot up. Try to grab the heel. Pull it in again, keeping the shoulders flat on the ground. Good. All right, guys. Let's get up off the ground. Let's stand up here. We're going to do our last one, which is that reverse prayer stretch. So you're going to stand, put the hands behind your back here, get them into a prayer position. Feel that stretch through the chest. Let's do a few neck rolls. Gently. Deep breaths. Try to relax. All right, how do you feel, Riley? Good. Good workout?
Yeah, good workout.
Alrighty. All right, everybody, you are done. You've completed the workout for the day. We will see you next time.
All right, good work, everybody. That was a good start to our week 6. We have Amy back tomorrow for the coaches clinic. And then with going into the 4th of July weekend, we are not going to have a workout on Friday. So Wednesday, we got a doubled up workout for you. So come ready to work on Wednesday, and we'll see everybody then. Have a good night, everyone.